Last week we talked about the difference between healthcare costs and insurance. Today we're going to talk about the second big lie, that you have no control. Healthcare is pretty complex, and that still doesn't mean it isn't possible to control the most egregious abuses. My name is Allison DePauli, and I started Altiqe Consulting to help employers get budgeting predictability, take control of your healthcare budget, with the happy side effect of better access to high quality care for your employees and lower out-of-pocket costs. For the best advice about how to shrink your benefits budget, make it predictable and controllable, all while improving benefits for your employees, subscribe to my YouTube channel down here and hit the notifications bell to be notified when I upload new videos. I want to give you a bit of perspective about how we got where we are today in the health insurance world. Many years ago, in the late 80s, early 90s, many mid-sized employers were self-funded or in a pay-as-you-go arrangement. There was always a guaranteed annual maximum, which is why it was so appealing, and the employer retained control of cash flow, which I think is especially appealing now. At the same time, Medicare Advantage plans were new to the market and beginning to become quite popular. However, the federal government mandated that a health insurance company that offered a Medicare Advantage plan could have no more Medicare members than it had commercial members, employer-based health insurance. That business was so profitable that many health insurance companies subsidized the commercial business in order to grow the Medicare Advantage business. I'm sure many of you have done something similar in your own product mixes. For mid-size employers, it made moving to a fully insured arrangement from a self-funded arrangement quite attractive. Over time, as both sets of plans matured, it no longer became as feasible to subsidize the commercial business. Then came the Affordable Care Act with its requirement that 80 or 85 cents of every dollar, depending on your size, be used to pay claims. The unintended consequence of that is that the only way an insurance company can grow is to allow claim costs to grow. Over the last several years, the traditional set of options, increase the deductible, co-pays, the max out-of-pocket, they've all been exhausted. It is no longer possible to keep passing the burden on to employees. Most employees don't have $400 to cover an unexpected an unexpected expense, let alone $2,500 for a deductible or to pay for an office visit if there's no copay. So they just don't seek care. Ultimately, this costs you more in the long run because they go seek care when there's an emergent situation. So what do? Nothing? Keep using the traditional methods of controlling your costs, or do you look for an alternative? The other issue that people don't talk about is how complex the actual care system has become. I have two parents who are both pretty healthy, but when something happens, they are entered into an incredible bureaucracy that is completely overwhelming. And I don't care how old you are, 20, 40, 60, or 80. My father had renal cell carcinoma a few years ago, and he's fine now. And I literally had to drag a nurse down the hallway by the hand to get him pain medication on more than one occasion. How is somebody supposed to handle that on their own? I don't care how old they are. As an employer, and as a best-in-class employer, how do you help? How do you provide resources and contain your costs at the same time? Well, you change how you think about healthcare. You change how you think it should be delivered. You shift your perspective to new communication tools, preferably in somebody's back pocket, like you've heard me talk about before, and to vendors who drive to high-quality care and have fiduciary responsibility to you. You've heard me talk about that 100 times now, and we'll drop some links to videos with more specific information below. Just know that it is possible to offer a best-in-class plan, low out-of-pocket costs, and help finding high-quality care. and at the same time, make your budget predictable and repeatable. If you're interested in leveling the playing field and making your healthcare plan work for you and your employees, if you're interested in saving your plan significant dollars, click the link below and let's see if we're a good fit.